Do we have quorum?
1, 2, 3, 4.
Okay, we're going to call this meeting to order of the Sacramento First Five Commission at 12:33 p.m. If the clerk could please call the roll to establish a quorum.
Yes, sir. Chair Serna is not here today. Commissioner Wesley? Not here yet. Commissioner Fernandez y Garcia?
Here.
Commissioner Gordon?
Here.
Commissioner Casirier? Not here yet. Commissioner Katari?
Here.
Commissioner Moak?
Here.
Commissioner Kennedy is not here. Commissioner Hassett?
Here.
Commissioner Williams and Commissioner Evans not here today. Commissioner Guerra?
Here.
Commissioner Boston?
Here.
And Commissioner Kravitz-Wertz.
Here.
Thank you. We have quorum.
Great, thank you. Do we have an announcement to read at all?
Yes.
This meeting of the First Five Sacramento Commission is live and recorded with closed captioning. It is cablecast on Metro Cable Channel 14, the Local Government Affairs channel on the Comcast and the RIC TV Uverse cable systems. It is also live streamed at metro14live.saccounty.gov. Today's meeting replays Saturday, April 11th at 2 p.m. on Metro Cable Channel 14. Once posted, the recording of this meeting can be viewed on demand at youtube.com/MetroCable14.
Thank you, Madam Clerk. If folks could rise and join me in the Pledge of Allegiance.
Allegiance, flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Great, thank you, everyone. Okay, Madam Clerk, we'll move on to our first item on the agenda.
Item number 1, approval of February 2nd, 2026 draft action summary.
Great. Are there any comments from the public on this, Madam Clerk?
No, sir, we do not.
Okay, let me bring it back to the board here, the commission. Any comments, questions, or in action?
Move to approve.
It's been moved by Board Member Fernandez y Garcia. Is there a second? Chair will second. Is there any further comment? If not, all those in favor signify by, do we have to do roll call on this one? All those in favor signify by saying aye.
Aye.
Very good. Motion. All those opposed? Hearing none, motion passes. Thank you, Madam Clerk. Let's move on to the next item.
Item number 2, public comments on off-agenda items.
Okay, Madam Clerk, are there any members of the public signed up to speak on this item?
No, sir, we do not.
Okay, seeing none, we'll go ahead and move on to the next item. Madam Clerk.
Item number 3, Executive Director's Report.
Good afternoon, directors. No, good afternoon, commissioners. Many of you are directors. Lovely to see you all today, and I have a pretty lengthy director's report, but I'm not going to cover it all just because we have a very big agenda today. I wanted to get just a couple highlights. Last month, we gathered to celebrate our Equity and Action Committee. It was a wonderful night down in South Sacramento. Showed them our appreciation. We were joined by Commissioners Fernandez y Garcia and Alicia Williams as well. So it was truly just a wonderful evening, and we're so appreciative of all that they've done. The Steve Wirtz Champion for Prevention Award will be announced, I believe, tomorrow at the Board of Supervisors, but we got special permission to announce it here early since his daughter, Nicole Kravitz-Wertz, is one of our commissioners. And the winner this year is Karen Parker. Karen was a retired social worker with the Department of Child, Family, and Adult Services, and she was so instrumental in bringing our Family First Sacramento program together with the Prevention Services Act dollars. So, and did so many other things, but a very, very worthy recipient. So we're very happy for her. We have Advocacy Day coming up, which Commissioner Wesley will join Aaron Mari and myself at the Capitol. We have many things we're going to be talking about, which are in your packet, including some asks from the association and a very large ask from CSAC. So all things to help kids and families. Our SAC Family Connect Summit took place in February. And we had like over 300 people who wanted to attend this. We had to cap it at 250. It was parents, community members, providers, elected officials, leaders, just so many people in this space together, including two of our commissioners, well, three, if you count Dr. Wesley, but also Dr. Fernandez y Garcia and Eric Guerra were present. We have just a very quick video clip, under 2 minutes, that I wanted to share with the group. So I'll ask Metro Cable to please cue that.
Having a seat at the table is an opportunity to change the game. Be well heard while letting your voice be the lens.
I always have to fight for something, whether if it was a seat at the table or just for my voice to be heard. So as I lead the next generation, their voice will be heard as well.
Meaningful change can happen when parent leaders, service providers, and even community partners come together with a shared purpose.
And that's why parent leadership is very important, because we all come from different aspects of life, and it is very different when you grow up.
Being in this room right here, we are rising.
PLTI was life-changing for me. I learned that if we're not working on the whole picture, the whole body, the holistic approach to the family, then we're not sustainably creating change.
I've always felt that my calling is to serve the community, which raised me, so that's why I do all this stuff.
Today was amazing having all the people in our community in Sacramento who support children and families.
I learned so much, how to show up and be available to our children as well as to the entire community of Sacramento.
Yeah, it was such a great day. And we now know we have to do that at least annually and bring everybody together. So thank you for all of you here who participated in that, and my team that worked so hard to pull all that together. But it's absolutely worth it. It's fantastic. There's also a list of Birth and Beyond tours that are still happening in your packet. So if you haven't signed up for one and you'd like to, please do so. In good news, we did receive a $150,000 grant to help us help our partners get ready to bill for CalAIM and Medi-Cal services that they are providing. And so that's exciting. We've had a focus group and first training underway, and more to come on that as we continue to do our best to build sustainability for our agencies. Let me just see if there's anything else terribly exciting. We did have, again, our PLTI parents just leading, just taking on the mantle of bringing their voice out to community. So they're getting appointed to, one of them to the City of Sacramento Planning Academy, just out there, and they just continue to spread the importance of the first 5 years everywhere they go. So I will stop with that, but just so many good things happening right now.
Great. Well, thank you so much, and it was great to participate also on and what a great theme, a seat at the table, right? And love the menu concept as an agenda. I thought that was catchy.
Yes.
Very good. And let me bring this, Madam Clerk. Do we have any comments from the public on this?
No,
item?
sir, we do not.
Okay, let me bring it back to the commission. Any comments from the commissioners?
This is Commissioner Wesley. I made it today, and I just want to concur that it was a wonderful day, and I had the pleasure of opening, but more so I had the pleasure of watching parents lead the very experience and convening that they wanted to see happen. So glad to be with all of you.
Thank you.
No, thank you. Yeah, and it was, I think, a unique opportunity to talk about what, as a parent, like how the challenges that even fathers face. I thought it was a unique conversation. I see Dr. Katari here, or Board Member Katari.
Yeah. Thank you. Thanks, Julie, for your report. I appreciate you lifting up the request that CSAC is making about the impacts as a result of HR1, the impacts on Medi-Cal, CalFresh, behavioral health services, and appreciate you putting that in the packet. I would just encourage everybody, to the extent that you can help us support this ask and do your own advocacy, that would be great. These the impacts, both from a fiscal perspective, but more importantly, to the lives of the people that we serve in terms of medical care, in terms of food security, are so important to address, and we're looking for the state's partnership to do that. So we've been partnering with CSAC and other organizations, CWDA, CBHDA, to make this ask, and would just ask that you all look at that closely. Thank you.
Thank you very much. Other comments? No, and I look forward to also trying to find a time to join you on the Commission Advocacy Day as well.
Yes, that would be fantastic.
Well, thank you very much. Seeing no other comments, Madam Clerk, we'll move on to the next item.
Item number 4, Advisory Committee Update, February 20th, 2026.
All right, Advisory Chair.
Nope, the advisory chair is actually a member of the public,
Oh,
and
the
so
public,
Robin
yes.
Blank-Scuster is here to provide that report. She's our vice chair.
Our Vice Chair. Welcome,
Newly
Vice Chair.
appointed.
I'm the newly elected vice chair of the advisory committee for First Five. I've been with them for about 8 years, and I know most of you have seen me and know me from everywhere. So thank you very much. Our chair is Maria Lopez, which you all have seen. She was elected 2026 chair, and she was part of that first parent leadership class, PLTI, that joined the First Five Advisory Committee. She most recently was an Equity and Action Committee member, and she's a child care provider and has a family daycare center, which, of course, is one reason why she's not here. During our last meeting on February 20th, we received an update on the new Equity and Action grantees and their projects, which was really magnificent. We had a presentation also about the Child Safety Forward Sacramento and their 5-year strategic plan update. This committee is strengthening cross-sector collaboration in Sacramento County to prevent child fatalities and fortify family well-being. I'm very proud of the fact that we have been able to cross-check and that we have people from different county agencies. It makes me very, very proud. Our next meeting is June 12th. Thank you.
Great, thank you. June 12th. Let me ask our clerk, do we have members of the public signed up to speak on this item?
No, sir, we do not.
Okay, let me bring it back to questions or comments from the Commission. Seeing none, thank you so much again for your service and for continuing to support on a volunteer capacity as well to help us move forward. Okay, Madam Clerk, let's move on to our next item.
Item number 5, Evaluation Committee Update, March 16, 2026.
Okay, Evaluation Chair.
So I was the chair last meeting. So we met as the evaluation committee on March 16th. Staff provided an update on the release of the data management system RFP. Proposals for that RFP are due on April 17th. The committee received and discussed the PLTI special study. The commission will receive a summary of the special study at a future meeting. And that's all.
Thank you, Chair Kravitz-Wirtz. Let me ask our clerk to see if there are any members of the public signed up to speak on this item.
No, sir, we do not.
Okay, let me bring this back to the Commission. Any questions or comments for our evaluation chair and committee? Seeing none, thank you so much. Okay, Madam Clerk, we'll move on to the next item.
Item number 6, Financial Planning Committee Update, March 26, 2026.
Okay, let's go financial chair.
Yes, filling in for that role, I think. Honored to be presenting, even though the news, I guess it could be far worse. If you look around our region, around the state, around the country, what's happening as it relates to reductions and just the harsh realities of funding in a variety of different places. We did meet on March 20. So the news isn't as grim as it could be, I think, is what I'm setting up. We met on March 26th. We didn't have a quorum, but nonetheless, the work continued. Staff provided an overview of the 2027 implementation plan, which will take up some of our time today, item 12 on the agenda. Obviously, we're faced with some realities that we have to make 20% reduction to our funding. Revenue has declined, and so you just have to. There's hard decisions at every turn to make. And having been on this commission for a really long time, this isn't the first time we've done this. It's never easy. It freaking sucks every single time. But I do feel good about the fact that we have taken the right steps to gather information about how we're going to go ahead and make some of these reductions. We first and foremost heard from parents and people who are using these services that we've rolled out and put out for so long. And that voice has to be the loudest, and in fact is within our decision-making process. We used county data, we've used our historical data, decades of relationships that we have leaned on to do some of this. So although, this is can't say the word, but like a crap sandwich, we know that we feel like we are going to be in a better spot than what we could have been. I know years ago, some of you, Tally in the audience and others who have heard the word cliff, this is not a cliff, this is a rolling hill that is slightly, on a downward trend, but we're going to make it work and we're going to figure out how to do it. So that was what we spent our time doing. We really worked to prioritize those areas where we know we can continue to have great impact, continuing to focus on equity and the things that we have held close to us for many, many years, but also just have to stay within our budget, right? When you go to the store, you got however many dollars to spend, and that's all we have. We wish we could manufacture more money, but where we are today, we can't. So it does strike a good balance. We feel good about it, as good as we can. But we will see that here coming up in a future item, and I'm sure there's people that will want to tell us how good our decisions were about it. So we continue to review the 26-27 10-year budget and 10-year financial plan. That's $20.9 million in total appropriations. So obviously, still in a good spot as we think with that. So that's item 10. So we'll get to that one as well. We reviewed our third quarter statements, and there was nothing to show there. Everything's in line with our budget and expectations as it relates to that. And I think that's as good as I could make a little bit crappy news, but we're all going to get through it together.
Yeah. Well, thank you, Commissioner Moak, for showing us the rolling hills.
Yeah, not a cliff.
Not a cliff. But let me ask the clerk to see if you have members of the public signed up to speak on this item.
No, sir, we do not.
Okay, let me bring this back to the commission. Any questions from our commissioners for our chair? I think I see nope. Okay, very good. Well, with that, let's go ahead and move on to our next item, Madam Clerk. Thank you, Commissioner.
Item number 7, Systems Optimization and Sustainability Committee Update, March 18, 2026.
Okay, well, let's get to our SOS chair.
Okay, so the SOS committee met on March 18th, 2026. I was the chair, and we did have a quorum. We discussed quite a lot. We received our policy and advocacy update, and we want to highlight our statewide advocacy day, equity and action committee recognition, and the upcoming state budget ask for HR 1. We discussed the results of the strategic and implementation plan parent survey. There were over 1,800 survey responses, and so that was quite a discussion in seeing what the beneficiaries of all of our programs think about them. And so it was a great discussion and included some priority ranking. which we'll hear about. We also discussed, again, as Commissioner Moak mentioned, our 20% reduction that we're facing in the SOS committee. Our discussions are around how to sustain and optimize the services that we have. So a lot of future planning, a lot of decisions made now that have impacts later on is our purview in this committee. So that's what we discussed. And then lastly, we received an update from our Touchtone Leadership Group and the next steps in the Equity and Action grantees. And the focus will be on capacity building and technical assistance. Our next meeting will be May 20th. We are going to again review the implementation plan before that comes to vote in June. And again, always thinking about that long-term goal. That concludes my report.
Thank you very much, Dr. Fernandez y Garcia. No, I appreciate that I had the opportunity to participate in the conversation as well, and appreciate the thoughtfulness on how do we manage the long-term stability given the consistent reduction. So, Madam Clerk, is anyone signed up to speak on this item?
No, sir, we do not.
Okay, let me bring this back to the commission. Any questions or comments from the commissioner? Seeing none, thank you very much, Chair. Let's go ahead to our next item. Madam Clerk.
Item number 8, public hearing, annual review of 2024 strategic plan.
I've got this one. So each year, as part of statute, we have to review our strategic plan that's in place for that year. As you know, we did a 10-year strategic plan this time, and we'll be looking at that whole 10-year plan. And this afternoon, we will be determining the implementation plan recommendations within it. But for today, we're just, staff are not suggesting any changes to the 26-27 strategic plan for the next year. That would be the third year of our 3-year strategic plan. So we would just recommend we hold steady and not make any changes. And that concludes my report.
Thank you very much. Let me bring this, Madam Clerk, do we have anyone from the public signed up to speak on this item?
No, sir, we do not.
Okay, let me bring this back to the commission. Any questions on item 8 for the annual review of the strategic plan? Seeing none, this is a voting item, and I think we do have one of our board members that has arrived.
It's not a voting item, it's a public hearing.
Oh, it's a public hearing. Let me open up the public hearing. And let me ask, Madam Clerk, are there members of the public signed up to speak?
No, sir.
Okay, we're going to go ahead and close the public hearing on this item. Okay, all right, there we go. We're all in order. Madam Clerk, we'll move on to our next item.
Item number 9, approve funding for her Health First to support the Sacramento Maternal Mental Health Collaborative's Be Mom Aware campaign.
Great, and Linda Fong-Samara leads this work for us, and will take this item.
Oh, yes, that's right. And before we get started here, we're going to have Dr. Commissioner Fernandez y Garcia, who will recuse himself for item number 9.
I will recuse myself from item number 9.
Oh, but we can't.
Siobhan, do you have?
Okay.
Oh, somebody's got it done.
There used to be snacks back there, but there's not. Budget cuts.
I was just about to say, you beat me to it.
For this item, we have 5 voting members only.
Very good. Okay, we have enough for a quorum, Madam Clerk?
Yes.
Very good. Let's proceed.
Good afternoon, Commissioners. Thank you. Good afternoon, Commissioners. Linda Fong-Samara. Thank you for the opportunity to share this item with you. We're asking for the approval of a contract with the Center for Community Health and Wellbeing, also known as Her Health First, in an amount not to exceed $43,000 to support the Sacramento Maternal Mental Health Collaborative's Be Mom Aware campaign. Just a little bit of background. Depression and anxiety are one of the most common complications of pregnancy and childbirth. At the time that I wrote this letter, it was estimated that 1 in 5 expectant mothers will be affected by a maternal mental health condition. And as of last week, California Department of Public Health released a new report that said actually it's a third or 35% of birthing people, prenatal or postpartum, will experience anxiety or depression. So it is a significant issue that affects both birthing people and their families. In addition, the risk is estimated to be even higher in specific communities. If you're a person of color, particularly African American, Latina, low income, there are higher rates in those communities. And unfortunately, we know from the statistics and hearing from the community that even if someone is screened, even if someone is told that they should probably seek some support or help, anywhere from 50 to 75% of those people do not get treatment or support. And we know that this affects us even locally. That's why we have the Sacramento Maternal Mental Health Collaborative, because a number of years ago, a local mom experienced an issue where she went to go get support and was escorted to a local emergency room by police and left the hospital with nothing afterwards. And so that's just background for you to kind of paint a picture of the issue that's happening in our community and why we're asking for additional support. As a result of that experience, the collaborative was developed. It developed a report of recommendations, and it asked really for a community-based campaign. The collaborative is a voluntary group. It's not managed by a particular organization. And so as such, in developing that campaign, the commission added $40,000 in 2022 to support some community focus groups to really help with the development of messaging, make sure it's culturally responsive, and really get that website up and going to help families get information and really get connected to support. So as with any website, any campaign, there always needs to be updates. And our landscape has really changed since, a couple of years ago. That campaign was developed during COVID. In that time, telehealth has really expanded. And in addition, we have CalAIM in our community. So there are more resources that families need to be aware of. And so the collaborative and its Be Mom Aware campaign is asking for support at this time to really revamp their campaign. They're going to do an overview of all of the pages, update at least 15 to 20 pages of the website, and really make sure it's ADA compliant, make sure the information is up to date, and really make sure that all those connections are new and relevant and able to really get families to the supports that they need. We have the funds available within our current implementation plan, and so we're asking for your support to continue to help grow the Be Mom Aware campaign and get families to the services that they need the most. That concludes my report. Any questions?
Thank you very much for that report. And let me ask, Madam Clerk, do we have members of the public signed up to speak? No, sir. Okay, let me bring this back to the Commission. Commissioner Wesley.
Thank you for your report about this opportunity. And I just want to say publicly, I've been in other spaces up and down the state on Black maternal health specifically and infant mortality. And I just will say our neighbors in our backyard right now in San Joaquin County have experienced 5 deaths, infant deaths since January, and we're just in April. So I think it'll be prudent on us to really lift this up. We're not sure, obviously, what those reasons are. Is it zip code related, environmentally related? Is it all of the things that you just noted? But I just think we are, First Five Sacramento has been a champion. I brag about us all the time, everywhere we go. And I'm, fortunate we're not experiencing that. But I think, as you said, since 2022, it's important that we continue to upgrade how we communicate to the community about everything from SIDS to other sleep-related issues to any other environmental factors or hospital stays, all of that. So my only question is, do we know what the anticipated reach is? And that's just a rhetorical question because I don't know. Folks here already know that, but I'm in full support.
So it is a website, but our partners at the collaborative, they do go out into the community. They've been doing a lot of trainings with community-based organizations to not just encourage them to utilize the website with their clients, but really train them about maternal mental health. I can see if they have some statistics for us about estimated reach. Unfortunately, our contacts had a family emergency today and couldn't attend, but I can get back to the commission about that. But just to let the commission know as well, this is a part of the SAC Family Connect website as well. It's featured on one of the main pages of our website, and we encourage everyone to use it. There is the ability to do things like take the Edinburgh on that website as well. So lots of tools for families to access.
Very good. Comments greatly appreciated, Commissioner. I also, we've had family members who have suffered from the mental health issues and even including postpartum. And it's still one where I think there's an immense amount of work that needs to be done in the community, and excited for us to be moving in this direction as well. Let me bring this back to the Commission. Other comments from the Commission? Seeing none, I'll entertain a motion from the Commission.
I'll make a motion.
It's been moved by Board Member Commissioner Qatari. Is there a second? That's Dr. Kassiri? Or who did I hear this say? Oh, Wesley. Okay. Yeah, Board Member Wesley. Any further comments? Seeing none, Madam Clerk, please call the roll.
Commissioner Wesley?
Aye.
Commissioner Gordon?
Aye.
And Commissioner Guerra?
Oh, I think Dr. Kassiri is here.
Pardon me.
Yeah.
Commissioner Kassiri? Commissioner Qatari?
Aye.
And Commissioner Moak?
Aye.
Thank you. Motion passes.
Very good. Motion passes. Thank you very much. And for the record, Commissioner Eric Fernandez y Garcia recused himself. Okay. We can let him back in if that's okay. Okay, Madam Clerk, we'll go on to the next item.
Item number 10, public hearing, approval of fiscal year 2026-27, recommended budget and 10-year financial planning.
Good afternoon, Commissioners. Before bringing the proposed budget before you today, Sacramento County Code requires that our budget be submitted to the County Executive's Office for review. It was submitted, the fiscal year 26-27 recommended budget was submitted on February 27th, and we did not receive any comments, so the budget before you today is ready for your consideration. Let's begin with Attachment 1, the budget highlights. Metro Cable, perfect, it's up on the screen for you. The fiscal year 26-27 budget marks the last budget of our current 2024 implementation plan. We are requesting approval of a $20.9 million operating budget. The majority of these funds, $18.86 million, or just over 90%, are dedicated to program expenditures, directly supporting services for children and families in Sacramento County. Administrative costs total $1.38 million, or 6.6%, and evaluation is $650,000, or 3.1%, allowing us to remain efficient while continuing to measure impact and results. The budget highlights also break down funding across our 5 priority areas under the 2024 strategic plan: health and well-being, parent partnerships, child care quality support, racial equity, and systems improvement. Together, that's a $16.2 million investment in community-based services funded through Proposition 10. In addition, we continue to bring in leveraged funding. For next year, that totals $4.68 million and includes CalWORKS and ARPA Building Strong Families funding. And these funds are important because they allow us to stretch our dollars further, to expand our reach and strategically invest in services that strengthen outcomes for children and families. At the bottom of the page, you'll see our reserves. We expect to begin the year with $12.5 million, along with $2.9 million in carry forward from this current fiscal year. To balance the budget, we are proposing a $3.4 million reserve release, which would leave us with an estimated ending reserve balance of $9.1 million. Looking at the revenue summary, we anticipate about $14.6 million in revenue next year. When combined with carry forward and reserves, this results in our balanced budget of $20.9 million. I'll pause here to see if there are any questions.
Any current questions from the Commission? If not, Madam Clerk, do we have anyone signed up to speak?
No, sir, we do not.
I see we have Commissioner Wesley. Who's that from the prior? Oh, no, here we go. Commissioner Wesley.
Yes. For the ARPA dollars, and maybe it's explained more fully, I'm just coming back online. For the ARPA dollars, how much longer will those dollars stretch out over time?
Oh, they're coming to an end, and these ARPA dollars will end December 30th of this year. So this is the last of our ARPA funding.
Okay. Thank you.
You're welcome.
Yeah, I think all ARPA dollars were supposed to be exhausted by 2026.
Mm-hmm.
So It was a helpful tool, but one that's no longer available. But okay, let me bring this back to the commission. Any other questions from the commission? If not, I'll entertain a motion to approve. Oh, it's a public hearing. Thank you again. Thank you. I appreciate it. It's a public hearing. So we're going to open up the public hearing here. Are there any members of the public signed up to speak on this item?
No, sir, we do not.
Okay, we're going to go ahead and close the public hearing. Okay, thank you, Madam Clerk.
I have one more attachment to review, if I could, please. So if Metro Cable, if you could please put attachment 2 up on the screen.
And while we're putting that attachment up on the screen, Madam Clerk, do we need to reopen the public hearing since we have another item, another piece of information that we posted?
I recommend that you do so.
Yeah, okay, we'll do that once we're done with all the information.
Okay, so up on the screen, you'll see our 10-year financial plan, attachment 2 in your packet. The column highlighted in green reflects the budget that we're presenting today. As you look to the right, you can see the continued decline in Proposition 10 revenues that we've been planning for. Even with that, we've been proactive. Just a few years ago, we were projecting a 37.3% reduction for the 2027 implementation plan, and today that reduction is 20%, much better. And I think that's a reflection of the thoughtful and deliberate steps this commission has taken to prepare for and soften the impact. The 2027 implementation or spending plan totals $11.9 million per year, as approved by the Commission on October 6, 2025. You'll notice that fiscal year 27-28 is lower at $10.2 million, and that's due to timing. Our READY funding is off cycle, and the Commission approved these funds to carry forward from the current implementation plan to fiscal year 27-28 to support a 2.5-year funding term for our Equity in Action Tier 2 and Tier 3 contractors. So this is not a reduction. It reflects approximately $1.6 million in prior year funding being utilized in that first year. Looking ahead, we can now look at the 2030 implementation plan, and we're projecting about a 25% reduction today. It's important to note that these projections are conservative. They don't assume any future leverage funding or any carry forward balances, both of which have historically helped us soften the impact in reductions. And similar to 2027, the first year of the 2030 plan is also reduced due to the READY funding being off cycle. So with that longer term outlook in mind, the proposed fiscal year 26-27 budget reflects a balanced and thoughtful approach. We're prioritizing our direct services, leveraging additional resources, and planning ahead while making prudent decisions about the use of our reserves. Staff recommends approval of the fiscal year 26-27 budget and 10-year financial plan. I'm happy to answer any other questions.
Okay, we're going to go ahead and reopen the public hearing after the additional information item there. Madam Clerk, are there any other folks signed up to speak from the public?
No, sir, we do not.
Okay, great. We're gonna close the public hearing again. Let me bring this back to the board here, the commission here. Are there any questions from our commission? Seeing none, let me entertain an action from the commission for approval.
I'll move.
It's been moved by Commissioner Moak. Is there a second?
I'll second.
It's been seconded by Commissioner Katari. Okay, Madam Clerk, please call the roll.
Commissioner Wesley.
Aye.
Commissioner Fernandez-Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Casirye.
Aye.
Commissioner Katari.
Aye.
And Commissioner Moak.
Aye.
Thank you. Motion passes.
Great. Thank you, Madam Clerk. Okay, we'll move on to our next item.
Item number 11, public hearing, review of First 5 California fiscal year 2025-26 annual report.
This one, Carmen Garcia Gomez, our evaluation manager, will handle.
Good afternoon, Commissioners. I'm Carmen Garcia Gomez, and I will walk you through the public hearing for First 5 California's fiscal year 24-25 annual report. Every year we come to you around this time to give you a glimpse of the First Five California's annual report. This year you should have some copies of the annual report up there for you to look at, and also we have some in the back. Okay, the annual report covers the period of July 1st, 2024 through June 30th, 2025, and provides a comprehensive overview of the state's programs and services. Also included in the report are fiscal and service data relating to the County Commission's collective result areas of improved family functioning, improved child development, improved child health, and improved systems of care. According to the annual report, First Five California received $53.7 million, and county commissions received $214.7 million through Proposition 10, Prop 56, and the California Electronic Cigarette Excise Tax revenues in fiscal year 24-25. The total of these allocations represent a 20% reduction in funds received from the previous year. So they're also seeing reduction in funding. Between the 58 county commissions, 699,215 services were provided to children and 555,293 services to adults. The total expenditure for in the three primary result areas was $298,000. And then also they have additional result area of systems care, and the expenditures for that result area was $83 million. Collectively, combined, all four result areas had a total expenditure of $381 million. The report also includes program and services highlights that can be found on pages 52 through 104. First Five Sacramento submitted information on the Equity and Action initiative, and the highlights can be found on page 84. And this concludes my report.
Great. Thank you very much, Carmen, for that report. This is a public hearing, so we're going to open up the public hearing. Madam Clerk, are there any members of the public signed up to speak on this item?
No, sir.
Okay, we're going to go ahead and close the public hearing. Let me bring this back to the commission here. Any questions or comments regarding the annual report for First Five California? Okay, seeing none, thank you, everyone. Madam Clerk, we'll move on to our next item.
Item number 12, discussion 2027-2030 implementation plan updates, review of parent caregiver survey data, preview of recommended investments by priority area and strategy.
All right. Well, we'll move from that last sleeper item to the big one of the day. So thank you for cueing that. Yes. I'm gonna channel Commissioner Moak and say that while we're here to discuss some difficult decisions, I did want to frame it with some positive points to make at the beginning. First Five was able to hold steady in our funding for the last 6 years of our 2 implementation plans. And this was very rare to do in the state of California with all the decreasing funds. So I'm very proud of us. We not only did we stay steady, but we even doubled down on our equity work during that time, created a whole new strategic plan that was a 10-year plan, and we did amazing things over those last 6 years. So stuff to celebrate for sure. And now we are implementing our measured reduction of 20%, and while actively pursuing additional dollars, which is what we do all the time. We have even brought in, just during this current strategic plan period, about $16.9 million just in the 3 years of this current implementation plan that really allows us to have the gradual instead of the very steep cliffs that Commissioner Moak talked about. So the 20% planned decreased has been well communicated not only here, but out amongst our partners. Last week, I was able to personally connect with almost every director or lead from programs to let them know what was happening today at the commission and what the recommendations from staff would be, just to ensure that they would have adequate time to plan and to speak with you if they wanted to. Commissioner Moak, I apologize for the 21 slides just up front. I do try to keep it to 10 or less, but today's discussion will have impacts for the commission as well as our funded partners. And I just wanted to make sure that we had the opportunity to look at some detail and have some rich dialogue about the recommendations.
Back in the early 2000s, it was 5 slides. So just to show how far we've come now.
I'm quadrupling today. And because so much of the implementation plan work was done outside of the commission through an ad hoc committee and with staff, I just wanted to make sure that this came to you as a discussion-only item before it came to you as a voting item, because I wanted to ensure that you could have the dialogue here today. So this item is discussion only. We will not be taking a vote. We will be hearing from community. But staff are, again, providing you something to react to. This is our best thinking. And we heard from community. We looked at the data. And we took into account a lot of different things around our funding to be able to bring to you these recommendations. In June, when it comes back for a vote, there will have to be recusals. I think several of you know who you are that would need to recuse yourself at that time. But after checking with County Council, you are able to speak today to anything on the agenda. Okay, the rest will go faster than that, I promise. Oh, okay. Okay. So this is just a quick reminder of the implementation plan efforts that staff worked on over the last 14 months, along with the related decisions, which include, of course, the $35.7 million spending plan that was approved last October, and that is related to the implementation plan we'll be looking at today. So again, just to put it in perspective, it's a 10-year strategic plan with 3 very distinct implementation plans, and we are looking at funding allocations today for the 2027-2030 strategic plan or implementation plan period. Okay, so this is the fiscal cliff slide. We used to show this slide very frequently, but we've had stable funding for 6 years, and I haven't trotted it out for a while. But there is an overall drop of 27% in revenues from the projected high in fiscal year 2025, which was $9.9 million in just Prop 10 revenue, down to $7.3 million in Prop 10 revenue that we anticipate in 2033. And then over the same line, or over the same period, and by the Commission's design, the fund balance, the orange line you can see, is used to lessen those cliffs and make it more of a steady decline. And that shows an overall decrease of 74% of the Commission's minimum fund balance, or our reserve, which would bring us down in 2033. We'd be down to that $3 million, which is what we have a policy to never go below $3 million in the plan period. Okay. This slide provides a historical look at our funds available for implementation plans over the last 20 years. It indicates our stable funding. Those 2 middle bars are the last implementation plan and our current implementation plan. And you can see 2027, the 20% cut. And right now we're estimating 25, but we do hope that that is much better in 2030 to 2034. Okay, so just to a final refresher, I think, before we jump into the new slides, but this is our spending plan. We always have to break it out by admin, evaluation, and program. So you can see how we're spending our money over the 3-year period for that total of $35.7 million. Okay, so staff used a 3-pronged approach, essentially, to develop the implementation plan that we're talking about today. One of the, am I missing one slide? I'm sorry. Yeah, that just jumped way too. I'm like, where am I? I was sorry. I don't know what just happened. That's like, that is wrong. I got to go back. It's still going.
And Julie, maybe while you're finding it, just one thing, I do feel like it's important to note, because I do see some obviously familiar faces in the crowd, but also maybe some new folks. It's important to note that the decline, maybe this is oversimplified, but there used to be, if I remember correctly, 2 billion packs of cigarettes sold every year in the United States. Is that right? 2 billion in the United States. I think that was the number we saw. Oh. That is now down to 550 million packs of cigarettes, which that tax, the tax on that tobacco product, is where we get our money. We're using the devil's money to do God's work. And so for you smokers, I apologize. So it is important to know that this, even back in the late 90s, early 2000s, this was we always knew that people were going to smoke less over time as more information and all the things, people made better health decisions and all the things, thanks to Dr. Kassirier and doctor, that this is why we are getting healthier. And so this is a planned decline. We've known this for a long time. It didn't decline almost as fast as we thought it was, plus there were some other protective factors that we put in. But it's just important to note that that's why we're losing money, because people are smoking less.
Yay.
Period. Yeah.
I know.
Thank you, Commissioner Moak, and none offense taken as a former 2-pack-a-day smoker. But, yeah. but glad it's been 13 years this year. Thank you.
All right. So yes, I am going to talk about the 3-pronged approach. So we looked at 3 different things in considering the recommendations before you today. We were informed by the Community Trends report, which you all saw back in October. And then we engaged in the community input process, which you'll hear a little bit more about today, but that was our work with an ad hoc committee, and including focus groups and a survey and all that good stuff that we did to make sure caregivers' voice and how First 5 money should be spent is front and center in our thinking. And finally, we applied the foundational principles lens through which each identified strategy was measured. And we'll talk a little bit about each of these. So this is just for your refresher. The first thing that we showed you back in October related to trend data. And in this slide, there were 6 data categories that aligned with our strategic plan. Those 6 are across the top. And there were 41 unique measures that our partners at ASR scored, and we looked at how those measures compared to prior years, thus getting the trend, and how it compared to the state rate, and if there were any disparities in the data for populations. So that was first thing that we did, was look at all the data to see anything green was, hey, we're doing great. Anything yellow was we kind of held steady from the prior years. And anything red was either it got worse last year, we are worse compared to the state, or we have a disparity issue with that particular measure. So all 41 measures were looked at in this way, and that data contributed to decision making. Then staff worked with an ad hoc group of community members and our advisory committee members who directed the community input process. They led focus groups and created the community survey. And the slide kind of will highlight the reaction or the demographics and the folks who were responding. And I'm just like so excited to say that we thought we were doing amazing 3 years ago when we had 805 parent surveys. So we had almost 3,000 people start our survey, which really is a testament to the trust that we've built in community over the last 3 years through our Parent Leadership Training Institute, through Equity in Action. We didn't do anything different in getting the word out, but it really was word of mouth that helped make this happen. The community survey outcomes, which are attachment 12.2 in your packet, provided a ranking of importance to the respondents who took them, who took the survey, that also emerged from the focus groups. The survey asked participants to tell us what they felt it was most important for First Five to fund. So the focus groups helped determine what the funding themes were. We listened and we created a survey that was very responsive to those themes that came out of the focus groups. Then we took all of those focus group themes, and the survey was really, of all these things, what should First Five fund? And they looked at 4 overarching themes of health and wellness, parent learning and supports, support for professionals, and changing systems. But I love this slide so you can see how we really hit the mark. Okay. Both slide 10 and 11 are our foundational principles. So we previewed these in August of 2025 with the commission, and we as staff sat down with our consultant and operationalized these to say, how could we turn this into a scoring rubric that put the lens of what was the most important priorities and principles for the commission, so that we had data, we had community voice, and we had what was important for the commission lined up in that 3-pronged approach. So staff used all these ratings and ended up with the scores. I just wanted you to be able to see sort of what that rubric looked like. And we ended up with scores that led to the recommendations before you. So now I thought I would take us through the recommendations, and this is the opportunity to have discussion and hear from community. The next 18 slides will walk you through the commissioners through the funding recommendations for 23 different strategies. Some strategies are going to be recommended for full funding, some for partial, and some for elimination. And the rationale for each funding recommendation can be found in attachment 12.4, which begins on page 170 in your packet. So priority 1, so I'm just going to take them by priorities, and I'll kind of quickly run through them because it's all in your packet. But we'll start with racial equity. That's priority area number 1. There's 2 interrelated strategies. One is the direct funding pathway to our providers. It is the lion's share of this funding. And it's what allowed us to bring in 35 new partners who had never sat at our table before. Staff really wanted to maintain the commitment to bring on those new funded partners. And it provides direct service dollars out to neighborhoods and communities that need it the most. The related strategy is sort of complementary investments to ensure that supports are in place to tell the story through evaluation. We are actually just recommending eliminating the funding for communication, but bringing that in through our normal communication. We've significantly reduced internal and external ready training and supports. And so are keeping we're recommending 36% of those funds to be retained. But for an overall 83% staying whole in this first priority area. Okay. Then we'll go to infant sleep. Priority 2, we recommend retaining full current funding for infant safe sleep. It's a promising practice with proven results to reduce infant sleep-related deaths. It specifically addresses disparities, and it was a combination of both systems improvement with the hospitals and direct service. Pregnancy peer support, also recommending 100% funding for this program in the next year. Check-ins with prenatal and postpartum scored second highest on the parent community survey, and our community trend report showed significant need for maternal and infant morbidity and mortality. It's also a promising practice that continues to deliver for this commission with, I believe, no infant deaths for the last 5 or 6 years running in that program. Breastfeeding support, we recommend a 50% reduction to breastfeeding support. It was not a huge priority in the parent survey, and our community trends report shows that we're doing quite well in this area overall. There are some disproportionate populations who are not breastfeeding at the higher levels, and so we absolutely want to continue some work, especially in those areas. There's significant opportunities to leverage non-First Five funding in this area. And our WIC department has higher than expected case rates. They've brought those consultants that we used to fund solely through First Five, they brought them in-house. They're now county employees that they're funding partially with the increased funding that they receive from their case rate. And again, the potential to leverage CalAIM and Medi-Cal is high. Developmental screenings, we're recommending 90% funding for this continued services. Supports for children with disabilities ranked pretty high, number 1 in the parent survey. And we have Help Me Grow, which is a very promising practice. And gets kids early on to mitigate negative outcomes later. Our developmental playgroups for children with exceptional needs, we're recommending 80% funding, and it also ranked fairly high, 3rd, and it's an evidence-based model with proven effectiveness. Strategy number 6, family engagement, enrichment. So this one we changed up a little bit. The Commission's school-based program goal, we created this more than 20 years ago. So we've been funding school-based programming for 20 years at First Five Sacramento, and it was our goal to insert early childhood education into the K6, K-12 system. And with the changes at the state level, with California State Preschool Program, with transitional kindergarten, this is happening. Kids are getting in to schools early. California State Preschool Program enrolls as young as 2 years of age for parents who want to do that. So it was a fairly expensive model for us, and we didn't have a huge uptake for those developmental play groups and the parent cafes that we were currently funding. But what we heard from parents in the survey very loud and clear, and throughout the Equity in Action grantee process, was that parents wanted enrichment. They wanted to be able to have their kids enroll in things that parents of higher income could participate in. And so we want to sort of redesign this to be a family enrichment strategy. So the school districts could absolutely apply if they were having a lot of success with a parent cafe or with a developmental play group. They could apply here, but so could community-based organizations or Parks and Rec or museums or libraries or others that had an idea for a family enrichment program. So we want to retain $500,000 a year for that overall and open it up to others. Under health and well-being, continues with strategies 7, 8, and 9. So these are our birth and beyond strategies related to reducing child abuse and neglect. We're recommending retaining 80% of funding for these 3 strategies. We have in Sacramento are fortunate to have an evidence-based model with proven outcomes through the Parents as Teachers model. We propose preserving these 3 strategies, but not having us prescribe how much funding should go to each of the 3. We really wanted to give the collaborative the opportunity to be in conversation with us about what they would recommend. They're in the work every single day, and we believe they are the experts and would best be able to guide the commission on how to get all 3 of these things, which we think are super important, accomplished with the reduction in funding, going from 12.6 to 10.1 million over the 3 years. We also propose incorporating the RAACD funding and it was already in this pot, but again, not to be prescriptive about how that money goes to the Birth and Beyond Collaborative. We would be in conversation. We would assume that they would look at data to see where the rates of abuse and neglect are highest, and that they would come back to us with a recommendation that makes sense for that. So just I wanted to allow as much flexibility as possible in that. For crisis nurseries, we're recommending retaining 90% of funding. It's a unique program. It's highly used and it's highly valued by parents. There is not another large funder. It is First Five, and our partner probably loses money on keeping these crisis nurseries open, but they do some fundraising which allows them to make it workable. But if First Five pulls out, we really feel like these crisis nurseries would go away, and they're so unique to Sacramento. They're such a bonus. Okay, so that is that, and I'll move us on to quality childcare. So this is our 3rd priority area, and it does take the largest hit, as you can see. We recommend full funding for the Child Care Coalition work, which has been renamed Lift Up Sacramento. This is a cross-systems partners who get together monthly to look at how to strategize around bringing in additional dollars to address both quality and affordability. For the child care quality supports, staff proposed terminating our efforts to provide professional development for child care providers. These services were initially designed to leverage First Five California funding, which is sunsetting in June of 2027. And we understand Quality Counts California will continue to work through other funding sources, but they're really going to focus mostly or entirely on publicly funded preschool and child care, whereas our local program, we were able to work with private child care homes and child care centers. So that's a shift in focus, and we know something will be lost by this recommendation. But we really feel like the shift to advocacy is our best lane here, because the answer to child care quality is very clearly higher wages for child care providers. It's more investments from state and federal government sources, and the first $5 will never fill this gap. It goes along with our principle to make those narrow and deep investments rather than continually diluting our funded programs. So one key thing to share is that the behavioral health consultation, that's a subcontract of this that works through Child Action, Inc., that is funded by our county's Behavioral Health Services Division, and they are continuing full funding. So our child care providers have access to behavioral health consultation for kids who are acting out and at risk of being expelled from private childcare. So that will maintain even as our dollars are eliminated. Okay. Almost done, sorry. This slide, our fourth priority area is parent engagement and parent partnerships. And we are recommending a pretty significant cut to an outside contract around parent engagement. We had previously used those funds to work with an agency that did hire a parent coordinator. And we have 75 PLTI alumni who are looking for opportunities to do work in community. And we just, it's cost effective and it puts those folks to work in ways that they are now trained to do. It just made really good sense for us to redirect 50,000 of that per year to stipends and to keep our parent leaders active in engagement and advocacy. Parent leadership, so for PLTI, we are recommending full funding. Again, we've had such great outcomes from this program. And the full funding for our community stipends reinforces our commission's core belief of valuing community voice in our work. And we recommend reducing language justice to 25% funding, which maintains, allows us to provide language translation and interpretation for monolingual parents involved in PLTI and all of our other work. Okay, last one. Systems improvement, our final priority area. In our first strategy, we've sort of lumped together several other strategies that were all related to health systems improvement work, like working with the birthing hospitals and perinatal care connection and a community workforce pipeline, and working with health managed care liaison to help us leverage CalAIM. So we're only recommending continuation of the CalAIM liaison position, and even that at a reduction. This strategy allows us to educate our staff and partners and assess how well they are positioned to start to draw down CalAIM funding. So that was important to us for sustainability. So we are proposing that we eliminate our work with the birthing hospitals and our perinatal care coordination work in our workforce pipeline. We haven't had huge success in these, and this current implementation plan is not necessarily our lane, I think. And especially working with hospitals, we don't have public health nurses on staff. We don't have that level of entree. And so keeping only what's necessary and giving up the rest of that. Our oral health systems work, while we've loved partnering to really work on several different projects, we're recommending that we keep a very small portion of this funding to work on community water fluoridation. Those contracts are coming up on their 20-year mark. They will be coming to an end legally, that they no longer have to abide by our contract and continue fluoridating. And we need consultant work to help us work with the water districts to maintain community water fluoridation. So that's what we'd like to shift the money to do that. Our Black Child Legacy Campaign Steering Committee work, we are recommend maintaining our funding toward that. SAC Family Connect, this is our sole area where everybody can come in and get referred to a home visiting and other program that they're eligible for. So again, streamlining services, coordinating, this is true systems improvement work. Prevention cabinet support, again, cross-systems work. Clearly, so much of our funding goes into direct support services for prevention work, but this is our little bit where we have into systems. And our public will and advocacy, again, this is just getting the word out when we need to and helps us with our advocacy. And I believe that is all of it.
A lot to take on here. Appreciate it.
Yes.
No, thank you. Thank you very much. Let me stop here and remind folks that I saw some folks come in that if you wish to speak to the commission, please get a comment card to the clerk as well, if you haven't done so as well. So let me stop this and let me bring it over to the commission for questions, and then we'll go to the public comment as well. So, see, Commissioner Wesley.
Hi, everyone. Again, Director Julie. I was looking at strategy 7, 8, and 9 around child abuse prevention. I will say there might be some opportunities coming up. As we move from 12.6 million to potentially 10.1 million. And just as a former foster youth, but really thinking about, there's a bill right now that's going through legislation. We're at the first house, I believe, still in the state legislature, but there's AB 2441 that's looking at FRCs, and also there's a national, I think we're signing on today, my agency, a national movement, also potentially look at dedicated funding from the federal lens. Don't know where it's going to go, either state or federal, but the First Lady, Melania Trump, is highly invested in foster youth. That's an interest area, which is interesting, but nonetheless, it could become a bipartisan issue that receives dedicated funding, from the feds to the state, and obviously to the county. So I was just looking at that, and I think I'm going to yield back until I have look at my notes.
We are also in support of that bill, have come out in support, and it's one of the 3 things we'll be asking during our advocacy visits in a couple weeks here. So, on the list for sure, and hopeful.
Commissioner Moe.
Thank you, Julian. Good job, and good job to your team. I know you put these 331 slides up, and it represents, the work and thoughtful work, and also very hard work, like emotionally and otherwise. Yes. You guys live and breathe this stuff every day, just like the people who are delivering ultimately the services from these resources. So kudos to you. I know it's like having it show in just a bunch of numbers and text boxes, like it doesn't articulate the painstaking work that went into it. So thank you for that. I do want to just because, these are going to be discussions that we collectively are going to have for the next 3 and then 6 and then 9, for many years to come as we continue to make smart decisions. I do want to, without a fear of putting you on the spot, under the home visiting, where is that now? I can't find that. But
I find it.
There it is. Strategy, that's 7.
7, 8.
Can that number, though retained at 80%, that doesn't represent the leveraged funds that this strategy also grows, right? This is one of the unique ones that grow money.
Yeah. Yes.
And how much? And so, I guess articulated in this way, do we know the approximate of what I know that some of it's just forecasting, but
we're pretty confident. It's about 4.6 million per year, in addition to what's up there. Mm-hmm. So, and that's a 3-year allocation. Mm-hmm. So it is a significant amount. Kristen, would you like to say anything?
Yes. So with that, 4.6 is hopefully leveraged each year. Mm-hmm. And yes, so the 10 million would be divided in 3, per year. This was how we leveraged AmeriCorps funding as well, but we can no longer leverage those funds.
Okay.
I was going to ask, is part of this money from AB I know all these bills number, AB 607, which just restored through CalWorks Home Visiting $25 million. Does it take that into consideration?
So this doesn't, and actually public health actually took the hit for that one for Sacramento this year. We did receive a $750,000 reduction, but none of that reduction went to Birth and Beyond. It went to the Nurse Family Partnership Program. It is being restored, I believe, and so their program can come back on. I don't know if Dr. K wants to comment on that. No? Okay.
And she has punched up to speak, so.
Oh, okay.
So, okay, let me bring this over to Dr. Kassirier.
Thank you. First of all, I just want to acknowledge all the work that has gone into this. I know we've had multiple discussions over the years, and we knew it was coming. But it still hurts when you get to the point of having to do it. And I know we've had this discussion, and I do appreciate that you made the effort to call out to all of the directors of the programs that were being impacted, to let them know of these, discussions.
Yeah.
And one that is near and dear to my heart, which I really feel a lot of emotions about, is the breastfeeding, because I do believe that it is so important to give these babies a good start. And one of the best ways that we're able to do that is with breastfeeding. I do hear what you're saying, that it didn't score very high with the parents, but probably because it's a small percentage, relatively small, that might be affected by it. But it is important. And one of the things that went through my mind, not that I'm asking you to do it now, but in future considerations, to see if we're able to look at return of investment, because I think when I was looking at all the data points that you are looking at, I felt that that was a piece that was missing. And I know it's not easy, because it's something we struggle with, all of us in public health struggle with. But I think it is necessary to see if there's something that we can do about it. I do have to admit, I cringed a bit when you said, we're doing pretty well in breastfeeding, so we can take the money.
I know.
Because unfortunately, that's what we face a lot in public health, is when you start doing well on something, then when there's a pinch, those are the programs that are impacted. Good thing is that this is not taking effect immediately.
Right.
So my hope is that, as you've done always, is that you will continue to work with the staff and see how we can fill this gap, because I think that this is still a very essential part and a core part of what we do in First Five, because it actually impacts the first year or so of a child's life, and a huge impact in a lot of ways. So I think it's important for us not to just say, well, we can put that aside. I think we still need to consider it. Going back to the question about the funding, I do believe that there was an initial cut, but that funding was restored to Nurse Family Partnership. Yes. But with the way things are going in public health, it's a roller coaster. We never know which funding is going to be hit next. So don't know. At least now it seems like it's okay, but don't know if it's going to stay that way.
Yeah. Thanks, Dr. K.
Thank you, Dr. Kassirier. I have Commissioner Wesley still signed up, and I do want to remind our commissioners we have about 10 people signed up to speak as well.
I just want to share one more thing around the play base at schools, and moving to family enrichment makes a lot of sense. As a former preschool teacher and practitioner and researcher in policy, I want to concur, and I worked on a state document that is now infusing play-based learning, which are the preschool foundations. I got to work with Wested on that. So I think we are well covered. And then what I always hear is what you said, is that we want to look for opportunities, the parallel what parents are on the other side of more robust economic well-being. So just wanted to put that in the public ethos, and I'll yield back.
Thank you. No, I agree on the access to enrichment as well. Okay, thank you very much. Oh, wait, let me, are these questions beforehand, public comment, or after?
I just want to follow up on something.
Perfect. Okay, Dr. Fernandez y Garcia.
So when you're doing the return on investment, if you take that on and bring it to us, I think it'd be also good to know, to the extent that you can, what types of other monies we're leveraging in the areas that there are cuts.
Yeah.
For example, with chest feeding, a lot of us might consider that a healthcare service that could be that we could leverage health systems and hospitals to help us provide, which would take some advocacy because generally they haven't seen it as a healthcare service per se. So those types of that type of information for each of those significant cuts might help us, have a different perspective when we're thinking about how those gaps can be filled going forward.
I didn't clearly say that we did that, but we actually did a big chunk of that in this work to say, is it leveraging dollars? Are our dollars primarily the only funding that are going toward this? We did look a little bit on return on investment, and we had, there was a whole list of those things. So we did some of it. Again, we will take it back and do another look through to see if anything surfaces differently, but it was all included, yeah.
Thank you. Commissioner Gordon.
Yes, just briefly, I have some concerns about some of these cuts, but in the interest of time, we have our early learning directors here who will speak before you, so I'll defer to that for the moment.
Thank you very much, Director Gordon. Okay, well, that's a good segue then. Here to say thank you, Julie. Getting a little bit of a rest there, and we'll have you back up here shortly again.
Okay.
Yeah. So we've got 10 people signed up to speak. We'll have a time clock here for everyone, and if you could, just state your name in the microphone for folks, and that would be helpful. And I'll name a couple, 3 at a time, just so you know yourself in order, and we'll go from there. We'll start first with, and I apologize if I butcher your name here. I've just found out that I need transition lessons, which when I asked what that was, they said it's bifocals, and so it was a little pain to the ego there, but it's okay. So Amelia Schendel, and then after that Lisa Matthews, and then Jeanette Newman-Velez. So Amelia, welcome.
Good afternoon, First Five Commissioners. I'm Amelia Schendel, WIC Program Director for Sacramento County WIC. I'm a registered dietitian and international board certified lactation consultant with 35 years of experience in maternal child health. I would like to thank you profusely for your unwavering support these last 24 years for the lactation program. Your commitment has made a huge difference. And I'm very grateful, despite these funding shifts that we're all have been preparing for, that you continue to recognize the importance of lactation and breastfeeding and continue to want to sustain this vital work. I was going to say other things, but I changed my mind, so I'm going to go off script. We would love it. I'm just going to come out and say it. We'd love it if instead of 50%, you reduced us to 30%. We have been working tirelessly to become self-sufficient. And like Julie brought out, we were so excited when we got that caseload increase. I'm like, man, anything we can do to wean ourselves off First Five, because we know that the funds are going away and there's vital services to be done. So we've been working and making tremendous progress that I'm very happy about, but we're not quite there where we need to be yet. We're waiting for AB 2160 bill that hopefully it passes and it allows us to bill Medi-Cal so our lactation consultants could actually be providers. So we're hoping that 30% reduction will buy us time, that bill passes. We're working with CalAIM. That one's a little bit, Lisa will speak more to that. But I want to leave you with a parting thought is, Lisa's going to talk our breastfeeding rates, and we're like so proud of them, right? We were at 6%, now we're at 34%. Wow. What if our vaccination rates were 34%? Would we be celebrating? What if they were 50%? Would we be celebrating? No. Breastfeeding is the first vaccine. So with that, I encourage you to support lactation a little bit more, but thank you so much for all that you've done.
Thank you, Amelia. Appreciate that. Okay, we'll go with Lisa.
Can I ask for clarification, just to make
Yes,
sure
Dr. Kasiri.
that we heard you right, Amelia? You said that you're requesting to be reduced by 30%.
230. I'm sorry, 230%. I misspoke.
Yes.
From 50 to 30. So instead of having a 50% reduction, we would have a 20% reduction. Yeah, I misspoke. I'm not good at numbers. Math is not my thing. But yeah, instead of the 50% chunk, if we just reduced it so that we would be to 30%, so that we would have
a 20%
30% more.
So you're saying instead of 50% reduction, make it 20% reduction?
Yes.
Okay.
Thank you.
Just wanted to be
That's
sure.
what happens when I go off script and start
That was
quoting
good.
numbers. I told Lisa, stand next to me because I don't do well with numbers.
Oh, great. Well, thank you. Thanks for the clarification. Yeah, thank you. We have Lisa Matthews, then Jeanette Newman Velez, and then Samantha Slater.
Good afternoon, Commissioners. My name is Lisa Matthews, and I'm the Breastfeeding Program Coordinator with Sacramento County WIC. First, I want to express my sincere gratitude for the steadfast commitment this Commission has had in supporting Sacramento families. Your leadership not only supported parents in providing human milk for their babies, it has transformed outcomes for thousands of families and strengthened the health and well-being of the entire community. As Amelia was speaking earlier, our breastfeeding rates have hit the highest exclusive breastfeeding rates that we've seen in at least my time here, but even before that, where we reached at least 28.6% of exclusive breastfeeding as of January 2025. When we look at those families that have received at least one lactation services from us, that rate goes even higher to 34.2%. Also, when we look at families that are providing any amount of breast milk to their babies, we are seeing 52% of those families, which means that over half of all WIC infants are benefiting from the health advantages of human milk. These numbers are not just metrics. They represent healthier babies, more confident parents, and long-term health improvements that echo throughout our community, impacting many of the Commission's result areas. I also want to note that 50 of the families that we served last year were not enrolled on the WIC program. This means that your funding has long-standing bridged the gap in access, ensuring that every family, regardless of WIC status, has access to quality lactation care. So I would like the Commission to consider, when you're looking at the funding allocations, to have a less of a decrease for breastfeeding, just so that we can make ourselves whole.
Great.
Thank you very much.
Thank you, Lisa, very much. Okay, Jeanette Newman Velez, then Samantha Slaughter, and then Karen Farley.
Good afternoon, Commissioners. It's an honor to be here again. My name is Jeanette Newman Velez, and I address you as both an IBCLC and a public health nutritionist with over 35 years of experience, especially in the WIC setting. In my current role at the California Department of Public Health in the WIC division, I oversee 58 WIC peer counseling programs within our state. And previously, I had the honor of coordinating CRP's activities as part of the CLA project for the past 15 years prior to that. So I have firsthand experience on the impact that your decisions made. First Five showed great leadership and foresight to affect all the things that are up on our screen right now, of trying to make a difference in reducing infant death, in reducing reducing child neglect and abuse by helping build parental bonds, and in even having long-term health effects with oral health through breastfeeding. A very simple and humble act that has powerful impact. So I admire you for this. What I'm here to tell you about is WIC's funding, WIC at the federal level, because that's where I work now. And even though WIC advocates for breastfeeding, what USDA mandates us to do is provide basic breastfeeding promotion and support. It does not require nor consistently fund board-certified lactation consultants to be a core part of WIC. We instead have to have registered dietitians, but not IBCLCs. So, and even though our peer counselor program has a portion, we're actually restricted in how much the IBCLC can be a part of the total funding formula. So it's limited in that. Also, I would like to have more money to be able to have more peer counselors, but the federal government is not giving me any. It's just the lay of the land right now. So that is why your decision a number of years ago to make breastfeeding a core part of what you do in your result areas is so critical. That was a narrow and deep impact, and I'm basically letting you know that it's important not to throw that flagship program away. But when you reduce this by 50%, it will throw that flagship systems change that you've tried to put in place. As it was mentioned by my colleagues a bit earlier, the narrow and deep changes you're trying to make still need a little bit more time to come to fruition. Thank you for your time.
No, thank you very much. Thank you, Jeanette. Thank you. Okay, Samantha Slaughter and Karen Farley, and then Joyce Baker.
Good afternoon, Commissioners. My name is Samantha Slaughter. I'm the breastfeeding program supervisor for CRP WIC. I'm also a lactation consultant. Our program partners with Sacramento County WIC to offer the skilled lactation support to families in Sacramento County. I want to begin by thanking you for your ongoing commitment to breastfeeding and the lifelong impact it has on the health and well-being of children and families. We have been actively searching for opportunities to sustain these services, and as Amelia put it, wean ourselves off First Five for years. So as you consider First Five Sacramento's priorities in the next funding cycle, I wanted to highlight our efforts to sustain the Community Lactation Assistance Project beyond the funding we've graciously received from First Five over the years. Our goal ultimately is to identify a reliable and consistent funding stream to sustain these services and ensure that any parent that needs support has it and that care is equitable and not dependent upon one's ability to afford it. Without this program, most parents on Medi-Cal would not have access to clinical lactation support after leaving the hospital, leading many parents to wean from breastfeeding or not even start in the first place. The challenge is that lactation consultants cannot bill insurance plans directly, so we must be creative. To date, we have leveraged relationships with Medi-Cal managed care plans to secure donations to help offset expected funding decreases. We have worked with a medical group to pilot a billing program. However, that because of the systems that we have in place currently, that's been very time-consuming and not sustainable in its current form. Additionally, we are seeking collaborations with FQHCs and other healthcare providers to partner with them and potentially bill for services. But again, nothing has come of that yet. And finally, both WIC programs are entering into MOUs with the Medi-Cal managed care plans in Sacramento County. We hope that this momentum will result in a formal and consistent relationship that will allow us to eventually sustain this critical program and support for underserved families in our area. There is momentum, but we are not there yet. Your continued support at any level makes a difference and helps us continue to provide these services to low-income families as we identify a way forward. Thank you again for your commitment to breastfeeding and the expertise of IBCLCs.
Thank you, Samantha. Okay, we have Karen Farley, and then Joyce Baker, and then Neri.
Good afternoon. My name is Karen Farley with the California WIC Association, and our members are the 83 WIC agencies across California, and we work on policy and systems changes. We've been doing this for lactation for nearly 30 years. There are some promising policy and systems changes coming as an outgrowth of CalAIM, and as you've heard, there are efforts to bring these to fruition, but it's going to be a few years for what we're seeing happening in lactation. Hopefully you're familiar with the Birthing Care Pathway, which is a comprehensive plan by the Department of Health Care Services to improve maternity benefits, including lactation. On March 25th, an all-plan letter was released to the managed care plans as an outgrowth of that. That includes maternity benefits, including lactation, but this is a high-level guide for managed care plans. What we now need are the details that managed care plans provide in their benefits and their policies. And there are WIC agencies around the state that are actually doing the hard work to work with health plans to write that. Help them write their own policies and benefits as a partner in lactation. So these are promising, and as Amelia mentioned, there's a bill, AB 2160, in the Capitol right now that would improve some lactation benefits, working with Department of Health Care Services and the Managed Care Plans. California WIC Association, the California Breastfeeding Coalition are co-sponsors of that bill. So we're encouraged, but it's not here yet. The WIC agencies are really good partners. They're meeting quarterly with the health plans, but we need more time. So we ask for you to consider this in your difficult funding decisions. And just referring back to the request for a return of investment on lactation, we do have an issue brief and analysis on return of investment for lactation as related to Medi-Cal benefits. I'd be happy to provide that. So thanks very much.
Thank you, Karen. Appreciate that. Okay, Joyce Baker, then Nara, BF's mom, I guess that's, if I read that right, and then Christine Smith. So yes, Joyce Baker.
My name may have been misspelled, but my name is Jocelyn Barker.
Sorry, Jocelyn, yes, Barker. Thank you.
Yeah.
Sarah, thank you.
I would like to say when I had my first child, I made it a point to take advantage of all of the resources available to me to set my baby up for success. WIC is a major part of that resource for me. While I was pregnant, my peer counselor, Amy, and my lactation consultant, Valerie, would answer all of my questions, send informative videos, and reading materials on breastfeeding. I was in constant contact even when I went into labor, as they were a trusted source of information and support that I needed in that moment to be successful. My baby was born with a serious tongue tie, which brought on a lot of additional questions about how it would affect my baby's ability to feed and possibly his ability to talk. My OC Valerie have been very helpful with addressing my concerns, especially after a late night research. She showed me how to latch my baby, which nipples my baby needed for his bottles, and more just to make sure my baby was well fed despite his tongue tie. Valerie had listened to all of my concerns and support for my goals to breastfeed my baby for the entire first year. Just from my experience, I could see the impact this program has on the community, from educational programs of food literacy to support groups for the mothers. The people who work at WIC make the program what it is. They have staff who've been in our shoes before, as first-time moms, also women with limited lactation support, as women just trying to feed their families. As this program continues to support moms, I hope that the Commission continues to support the program in its efforts to provide lactation support to the families just like mine. Thank you for your time.
Thank you, Jocelyn. Thanks for sharing as well. Nara, and then we have Christine Smith, and then we have Julie Moltali.
Hi, my name is Neda Barrero. I'm here as a mother who benefited from the breastfeeding support at WIC, funded by the First Five. When my daughter was born, she spent time in the NICU. She was bottle fed for 2 weeks. When I brought her home, she struggled with latching and I felt very overwhelmed that she wasn't getting enough to eat. I was really overwhelmed, emotional, and at times it was very discouraging. What made the biggest difference was the breastfeeding support I received at WIC. It was more hands-on, more available, and they truly understood the challenges I was facing in those early days. My lactation consultant, Yang, identified that my daughter had tongue tie and upper lip tie, something that had been missed by my health provider. She helped me clearly communicate this to my daughter's doctor so it could be corrected. And it also showed me different positions to successfully breastfeed her. Because of the support I received, I was able to continue breastfeeding my daughter. It didn't just help me breastfeed my daughter, it gave me the confidence, especially in that very vulnerable time for me. I just want to thank you for making the support possible and strongly encourage you to continue prioritizing funding breastfeeding services. They are essential for health, for the babies, and for the well-being of the mothers. Thank you.
Thank you, Nere. Appreciate it. Christine Smith, and then we have Julie Montali, and then Danielle Lawrence.
Good afternoon. Thank you. I appreciate being here with the First Five Commission. I wanted to start with, I'll be speaking to Help Me Grow and our thanks about that program, and Dr. Montali will follow with some comments and concerns that Superintendent Gordon referenced. So I want to begin by thanking the First Five Commission and staff for the continued investment in Help Me Grow and in the broader early learning systems that support children, families, and providers throughout Sacramento County. As you know, Help Me Grow connects families to developmental screenings, referrals, and resources, and that ranges from basic needs advocacy to complex system navigation. We work in close partnerships with many who are here, the Birth and Beyonds, Public Health, Child Protective Services, healthcare providers, childcare, homeless, domestic violence, and other community partners. And we play a critical role in early identification and early intervention. Help Me Grow refers families to Alta Regional and local school districts for assessments and ongoing support, and we collaborate closely with the SCOE Infant Development Program, where eligible children ages 0 to 3 receive early intervention service and home visitation. From the beginning of this current contract to today, our 5 family advocates have served 1,279 clients, completed 870 ASQ screenings, made 639 direct referrals, and conducted more than 1,300 home visits. And we anticipate doubling that by the end of our contract period in June 2027. And in addition, through community outreach, we've reached over 3,000 individuals with information about Help Me Grow, developmental milestones, and adverse childhood experience information. Looking ahead, we do see strong opportunities to expand countywide developmental screening and monitoring, as we have staff capacity to provide ASQ trainings to agencies who use that tool, and we could host screening data in the ASQ online system. We currently have, at present, 21 agencies use our system, completing more than 5,500 screens this year alone. With full funding, Help Me Grow has an infrastructure to serve as a central hub for training and data collection. So in closing, we deeply appreciate your continued investment in the Help Me Grow countywide system, ensuring that families received personalized connection, support in accessing resources, and navigation of often complex systems of care. Thank you.
Thank you, Christine. Thank you. Okay, we have Julie Montali, as I hear Dr. Julie Montali, and then Danielle Lawrence and Shannon Griffin.
Thank you. Good afternoon, Commissioners. My name is Julie Montali. I am the Executive Director for Early Learning at SCOE. We'd like to begin, of course, by thanking First Five for its many years of investment in quality child care, specifically through PBM, the Preschool Bridging Model, and our QCCC Quality Child Care Collaboration. Because of the sustained funding, Sacramento County has been able to build a system that supports all provider types in a way that is equitable, accessible, and countywide. Child care providers play a critical role in children's daily lives. They often spend the majority of the day with children, directly supporting their health, safety, stability, and development. These relationships are essential to a child's sense of well-being and belonging, and to a family's peace of mind, knowing their children are cared for in safe and supportive environments. Programs like PBM were intentionally designed to support unsubsidized providers who often lack access to equitable coaching, professional learning, and quality improvement supports. First Five funding has made it possible to address this gap. Supported by the First Five investments, SCOE has retained a highly qualified workforce of 10 early childhood specialists who are trained in resources and assessments such as CLASS and the teaching pyramid and pyramid model. These are evidence-based approaches that focus on positive teacher-child interactions, social and emotional development, equitable practices and inclusion, and they reduce challenging behaviors and suspensions. Through PBM, specialists provide practice-based, relationship-focused coaching that's been leading to sustainable quality improvement, high-quality early learning environments, and increased engagement with early literacy, math, and science development. First funding has also supported a specialized consultation team, bringing together behavioral health, the infant development program at SCOE, and Child Action to provide short-term collaborative consultation for programs needing additional supports for children. I want to give you just a little bit of data. 151 teachers and 80 sites have been supported in the last 2 years through PBM. That's 447 teachers and 279 sites through Raising Quality Together. Altogether, that's 598 teachers across 359 early learning sites. Ultimately, these programs are not just about child care, but the broader system of wellness. We would ask that you just consider continuing some of the investments for PBM so we can reimagine and deepen those supports for children every day. Thank you so much.
Thank you, Julie. Danielle Lawrence, and then Shannon Griffin, and then Amani Sawaris.
Good afternoon, commissioners. Thank you for being here. Julie, you know I love you, and I really do appreciate just the continued investment into the Birth and Beyond Family Resource Centers. Those of you who may not know, Family Resource Centers are integral to Sacramento. We can only speak about what happened when COVID happened and everybody else shut down, and Family Resource Centers were in community doing this work. So I'll just speak to that. We appreciate the continued commitment. Thank you so much. And I'm here to also talk about the RAACD specific funding that is now kind of being infused, right? It's always been set aside. In fact, MAN entered into specific RAACD fundings, specifically as a set-aside direct grant with First Five, and now we're within the Birth and Beyond Collaborative. We are committed to racial equity. We're committed to the reduction of African American child death and the disproportionate child deaths that happen in our zip code, without saying. But I will say this, I will say we are confident in our ability for CAPC and Birth and Beyond to work together and really bring out the enhancements throughout all the zip codes. What we want to name is that the infusing is something that we're looking for a commitment from First Five, right? On the heels of racial equity work, the way that these decisions are being made, we want to know that First Five is not forgetting their commitment to the initial dollars. We want to make sure that those commitments are rooted in data outcomes and evaluations for Sacramento County. We cannot forget that. The collaborative will work out what we need to work out to make sure that we're serving Black families well and that disproportionate African American child death doesn't go away. What has been built with Black infant health, with Black child legacy, and Birth and Beyond, that MAN is unique. And I have to speak to the intentional investment in the reduction of African American child death and the commitment at the funder level to continue the conversation and evaluate the efforts.
Thank you, Daniel. Appreciate your comments here. Okay, we have Shannon Griffin and then Amani Sawaris.
Hello, good afternoon. My name is Shannon Griffin, and I am the program manager with Sacramento Children's Home. But I cover the Meadowview area, and we also have our Valley High area. So I definitely want to thank the commissioners and just kind of take a little story back to, when Commissioner Cerna came with the whole Blue Ribbon Commission and the reason for that. So we want to definitely remind ourselves the reason why that was so important to do, and looking at the funding now and how we want to make sure that we keep that funding there and restore. So when I actually had got this and we were talking about it, I kind of took a seat back because I'm kind of a quiet type for those who know. And I listen and I assess. And when I heard it, and speaking as an African-American woman, I am a mother, grandmother of 7. And I too, the earlier conversation was talking about WIC, and I was like remembering that. So I was, did that as well. But when I look at the funding and what we're doing, the impact that we have made on African American families has been great. great, excuse me. But one of the things we want to also look at is when we start doing great things, usually we look back and we say, wow, we did a great thing. And now it's time to kind of move on. Well, one of the things I do just want to leave with everyone and the commission is that this is not the time to do that. Definitely not in the African American community. We talk about things, and not like here that we talk about bootstraps and things like that. We have to think about the fact that when a great thing comes in and they help, when that great thing removes itself, it makes a very big impact. And we don't want to look like we came in, we assessed the problem, we brought some solutions, and then we left. So we don't want to do that, because I talk a lot about know, like, and trust. And that's a business model, but it's also culturally responsive as well as a human-centered problem, and a model that we want to look at. And we don't want to leave. We don't want to make people feel as if we've provided something and now we're leaving. So I definitely urge that we continue to support these programs, and thank you guys.
Thank you, Shannon. Thank you for your comments. Okay, and our last speaker here is Amani Suarez.
Hi, I'm Amani. I am currently the Chief Operating Officer at the Sacramento Children's Home. We operate 3 family resource centers, the 2 crisis nurseries in Sacramento County, and 2 very specific programs inside of the FRCs for African American families, one called the Cultural Broker and one called the Village. I came to the SCH 2.5 years ago intentionally after having had an entire career, literally 35 years, as the Chief Operating Officer at Volunteers of America, where I lifted up, along with the teams, their maternal and child health programs, programs for children in foster care as well as transition age youth, programs for women who were incarcerated, and homeless programs. And after thousands of conversations, and literally I mean thousands, it became so clear to me that it most often starts in childhood, in the home. And I became so convinced of that. I'm not a social worker, but I became so convinced of that I decided that for the end of my career, I would come back to the beginning and continue to support the work that I think makes the most difference. And I wanted to come up here, and there's so many things that I want to share with you, but I think the most impactful thing would be to share a story. And it's a story of a woman named Ashley, who I want to remember as a young woman because I met her in a foster care program that we started called Adolfo, Transitional Housing. She had gone to foster care because of a history of abuse in her family. From the Adolfo program, she went to jail. I met her again in jail when we were doing alcohol and drug treatment programs for women who were in jail. I see my time is up, but someone will have to drag me off here. I met her again. Sorry, I feel a little choked up. I didn't expect that. I met her again at the Mather Community Campus when she was a client in our homeless programs. And I met her again 6 months ago at the Sacramento Children's Home, where she is a grown woman in her mid-40s who has had 7 children. One of them died in infancy. 3 of them were taken into foster care, and she has lost custody of them. And 3 of them are still with her, struggling with severe forms of mental health. And all I could think of when she was talking to me, and she was there begging me, I don't even know how she found me, honestly. She was there begging me to help her, and all I could think of is, what if someone had gone into the home early? What if before this young woman, who in my mind is still a young woman, had support, for her mother and father? What if she had had someone doing home visitation? What if the village was involved? What if the cultural broker was involved? What if she had those services early? So when we talk about return on investment, it's not just dollars and cents, it's also human suffering. And I have an infinite respect for First Five, but we talked here about multiple program cuts that prioritize the health of these types of that can make a difference in this work. We have
Thank you, Amani. Yes.
I think some time here to consider some intentionality and where we can make cuts so that we can really make changes in the trajectory of the lives of families like this.
Thank you, Amani.
Thank you for
very
your time.
much. Appreciate it. Okay, thank you very much to all of those who came and spoke today. Again, this is as our executive director mentioned, this is an opportunity for us to get an early start on this conversation before any real action has to be taken by the commission. And I think Commissioner Moak has said it best here that the decisions here are not easy, not taken lightly, and we know that this is only going to be much more challenging as the years go by. But I think the approach, personally, I want to thank Julie and the team and everyone involved on looking at a number of rubrics to figure out, what are factors we need to look at in this decision-making process. And many of these stories I can relate to personally, family experiences as well, going through those challenges. So I appreciate the willingness of the public to comment on that. So again, only our first taste for discussion. Thank you all who commented on those issues. If there are no other comments, again, this is just a discussion from the commission. And we will be revisiting then this again. Julie, what was the schedule?
Yeah, so, and staff are very open to commissioners' thoughts on any of this, and from hearing from community, if there's any questions that you have that I can answer now, I'm very happy to do that. Otherwise, I think it would come back to you pretty much as it looks, unless I hear some direction from commissioners today that says not to come back as it looks. It would come back very similar to what it looks now to you in June. And at that time, we do a little bit of a dance where commissioners have to remove themselves for certain items, but we try to make it so that most commissioners can vote on most items.
Okay, well, let me start off here. I see a couple commissioners have punched up, so let me go to Commissioner Wesley, and then I'll go to Commissioner Qatari. Commissioner Wesley.
Yeah, I just want to say I was a benefactor of the WIC program, and I breastfed 5 children, and that was really hard. I'm also a foster care child who's now an adult. So a lot of these issues are just intersecting. So my question to you, Julie, and maybe to the staff, and maybe and to us as commissioners, is there a way that we can look at the packet that you provided already to us to think about, can any of these, if there are any blind spots any of us have, to streamline or leverage, knowing we have to make cuts and they're difficult, and all can really, people are whole people, they're not divided, and we all know that. But how do we think about, in the whole child, whole family systems work, is there any opportunity that we may have missed to leverage, link, while some of these bills are passing through? We don't know where they're going to land. Maybe we'll know more in June. But like you said, Julie, you're asking right now how we can look back. And I'm thinking about the ROI, return of investment. Is there a way that one more look, anything we can leverage, organization to organization, dollar, budget line item to budget line item? I'm just thinking about my family. We needed all of this. We needed housing. We needed WIC. I was a welfare to work mom. So all those supports have gotten us out of poverty into another tax bracket. So now we're, contributing, but just want us to maybe just take and putting responsibility on us too as commissioners.
Julie, I think it's a bit of a complicated question there, but in the sense of where do we find new money, or are there adjustments that could be done
We're continually looking for the new money. It's absolutely something we do every day. Again, we may know more about these bills by the time it's coming forward in June for vote. and to see what kind of support can be brought in. Again, these cuts are a year out, and I do feel like things do change in a year's time, but it's always been the prerogative of the commission to give that much time, and it takes that much time, quite frankly, if we have to go out to bid for new things. That's why we start strategic planning 15 months in advance, is so that we have enough time for the procurement process and for people to understand what the cuts will mean. Yeah.
Okay, I have Commissioner Qatari and then Commissioner Kasiria here. Dr. Kasiria. Commissioner Qatari.
Yeah, thank you. Thank you, Julie. Thank you for everyone who spoke today. It was really informative, and we really are committed to the programs that you all spoke about today. I did have a question, and I don't know if it's for Amelia or Dr. K. If AB, and you don't have to answer it today, maybe it's just information to get back, but if AB 2160 does pass, what gap does that leave in the WIC programs for your ability to bill or not bill Medi-Cal? I'd be interested to hear more about that at some point. Thanks.
Thank you very much, Commissioner Kasiria. Commissioner Qatari. Dr. Kasiria, yes.
Thank you, and we'll get back to you on that. My request to Julie is, question. One is a question. Is there opportunities for wiggle room or to look at other alternatives in terms of, okay, this is plan A. What if you looked at it differently? Would there be a plan B? And is there an opportunity to maybe bring this to a subcommittee of the commission to look at it more and have more discussion in terms of the different options, and then bring an option up for vote in June?
I guess if so directed, I don't know what, I don't know how commissioners would look at the same thing. Like, you've seen the data. I guess you haven't seen all of the community. A part of your packet included all what was rated from the community input and the priority, the leverage, or not leverage, the foundational principles. Could we run it all through with you? Yeah, we could.
I guess my question is, can we get more than one option?
Yeah. Yes. Yes.
Okay.
You could get more than one option. I'll have to figure out how to make that. But yes, you could get more than one option.
I think the risk just becomes some of the timing, the mechanics around timing when. Well, this isn't the one that goes to the board of supervisors.
We don't even have to go to the Board of Supervisors because we adopted a 10-year strategic plan. So we only have to do, the implementation plan is here. The Board of Supes would approved the 10-year strategic plan already. Mm-hmm. So the funding plan piece is solely at the discretion of this committee.
Yeah.
I would just not want to push anything out past June, because then you are looking at, yeah.
Well, it's a shorter time frame for these folks to start to prepare what their programs are going to look like. Some of these you added a great deal of flexibility inside of the funding stream for some of the ones that have been around for a long time to be able to tell you/us what they're going to do with that, which is a little bit of a new approach, far less prescriptive. So they're going to need time to figure that out. So, yeah, I right before this I came. Sorry, I wasn't even on the.
And I was just about to,
sorry.
reprimand you here.
Just like she apologized. I came from a medical appointment with my 11-year-old right before. Or 12-year-old, right before who was a first five baby, right before this, and he didn't know he was getting his 12-year-old checkup, which included all the shots. Mm-hmm. Right? I didn't prepare him for that, and so as he sat there, and the doctor told him that he was getting shots today, he lost his mind for a minute and then realized, like, I either have to get it done today and it's going to hurt, or I could think about it for 6 months or 3 months or whatever, and it's going to freaking hurt then too. So like I just mentioned with Doctor here, and he asked, in my experience, every time we do this, it is painful no matter when it happens. And the good thing is we do have the data. You have provided us all with the information. It's robust, and it takes some time to go through. Yes. But the numbers are there. The families have spoken. That's something we haven't done in such a robust way in prior years as we have this time. So that, to me, is what I very much appreciate, is that we have parent voice in a way that we've never had before. And it just sucks. Like that, I let it off at the beginning. These are hard discussions, and everything, what to do when everything is a priority, right? Like, I get it. It's brutal.
Thank you, Commissioner Mocha. Let me go back to Dr. Kasiri. If that was the final end to your question, it was if we could get another option to the proposed plan.
Yeah, that was my question, but I'm not sure where we go from here.
Yep. Thank you, Dr. Kasiri. Well, let me bring it over to Dr. Gordon, and then I'll have a comment here as well. Dr. Gordon.
I just wanted to reiterate, based on the comments today, I think it's at least worth another look, so that we're not necessarily bound to what was presented today based on
That
the
was
comments,
my purpose in bringing it.
and perhaps look at some options next meeting.
Thank you. And that was the intent, I think, from the executive directors, to get at least the feeling from the commission on where the mood is here. I think the acknowledgement is that there isn't any new money. This is what we have. So if we add in one location, we must take from another. Yes. Like that's the old squeezing the balloon in this situation. And so it's a challenge, and our oldest child had challenges at breastfeeding. It was a difficult one where we needed a lot of help, and everything that associated with that afterwards was even much more complicated. And it didn't get easier with our second one, which we had hoped it would. But so I appreciate everyone who came up and spoke on that need, because the expertise was necessary. But even with that, listening to that and remembering, what our family went through with that, it goes back to where we are with the finances here and where we are with the available dollars here. I do want to say that I think to Commissioner Kasiri's request here is Julie, if you could go back, I think the information was brought to us was robust, but if there is another avenue, I think you heard someone bring up a different percentage amount, and what does that mean if that percentage amount was to take place? And then we will know closer to June whether AB 2160 has got some legs in it or not. And obviously anything we can do to get CalAIM's funding and get our revenue back is critical. I think the one important factor here, regardless of what issue we're dealing with, whether it's mental health, whether it's the preventative care, whether it's child care, very proud of Lift Up, Sacramento, and I'll toot my own horn here because I helped initiate that. Yes. I as chair of SETA, if I knew I was chairing today, and I would have worn the first 5 sweater, by the way, but I was chairing SETA earlier today. We were able to bring that. And I think the important thing also is what's within our lane. What can we do as well? Where is our strength at as a commission? And there may be areas where our dollar will go further based on what our expertise is, and where we can leverage other agencies. And I do think, this is not new to me, but I would like to maybe work with Dr. Kasiri and Dr. Fernandez-Garcia as well on the health plans and piece as well. Dr. Katari on what is I don't know if we've approached them on this particular question in a much more aggressive nature about what are the areas they can backfill in this, even if it's in a short window as we see this this legislation move through. So I'd like to entertain those conversations. So
okay.
I just want to say one thing while considering that and whatever policy bills that might impact us for the better, also paying close attention looking at the bill implementation, because that will impact us. So just from a policy lens, we want to make sure what is their intention on implementation, how they might consider rolling those dollars out to specific state departments that then would come to us as a county. So looking at that timeline as well.
Right.
Okay. Well, Julie, I think, did you get direction here?
I think I did. I'll circle back and figure out, is this something to do with a subcommittee? Is it bringing back our ad hoc work group? One of those two things. And then, I need to think in my head about how it looks to provide options and not be all convoluted for you all, not to have too much to, I'll try to keep it clear.
Too much choice sometimes it makes you, it's like looking at my cable list of options. Like, I still go back to the same channel, sometimes. But I do want to, also recognize that when we do ask for responses, sometimes the response back is there's really no other room here. So that, I want our commissioners to recognize that may be the response back after you go and dive in, because there was a lot of work done.
There was, and I did find my notes about what did we look at. We looked at community assets, other funding resources, changing funding landscape, the cost to run a program, scalability, both up and down. Like, is there a certain point where you cut off and you just say, now we're only going to be serving 20 people and it's just not efficient or effective? How are current programs being utilized, and several other things. So we kind of had this whole thing that we were, and we did a lot of that through looking at the foundational principles too. So a lot did go into it, but again, I brought it so we could discuss it because I did want to hear what was surfacing to the top about the biggest concerns, the biggest red flags, and I think I got it. So I will do my best.
I would like if you could look at or consider the return on investment, since someone did say that they can provide that.
Yes, I will get that from Karen. Thank you.
Thank you, Dr. Casaria. Okay, let me ask the commission one last time. Seeing no other comments, thank you again for that work. That was that's probably our biggest, toughest item here for the day, and will be the next time we visit it again.
Yes.
So let's get, as you said, let's wait for the next time around.
It's going to be hard then.
Yep. My kid went through his 8-year-old, or was it 6-year-old shots, and he's not going to look happy at the 12-year-old shots. Yeah. Okay, Madam Clerk, we'll move on to our next item.
Item number 13, presentation, fiscal year 2024-25 annual evaluation report.
Perfect. We have Alyssa joining us from Applied Survey Research.
Yeah, I get to follow that very robust conversation and hopefully
some happy news.
Lighten it up with just
yes,
some highlights from the past fiscal year.
We have news. We're cutting you by 14%. Sorry.
I was literally sitting there being like, don't need to say that.
Oh, we're already lower than the required amount in evaluation across all first five. So
for sure, yeah. Well, hopefully my time up here will highlight our programs well without going into taking up too much time. So we will. We are reviewing each of the 5 priority areas. And just as a reminder, our direct services programs are evaluated on a results-based accountability framework, which the goal of RBA is to link strategies to a broader community need. And then we look at reach, quality, equity, and participant impact to make sure that the strategies, together with other community organizations doing similar work, are turning the curve or strengthening our communities in that area. So we'll jump right into our first priority area, which is racial equity. So racial equity, diversity, inclusion, and cultural responsiveness is embedded across all of First 5 work, including a comprehensive internal and external review of policies and practices, community engagement, and investments into non-traditional partners that serve under-resourced communities. The Equity in Action Initiative was launched, including the committee that you all have heard about, made up of diverse community members to support funding decisions for the $4.2 million investments into these goals. 300 Black family culture kits were distributed to 5 partner agencies who use them as engagement incentives, and the kits were developed by Black Californians United for Early Care and Education, or Black ECE. First Five also funded 6 scholarships for the Black ECE Professional Development Series for early educators. Together, the Family-Centered Direct Services programs covered under the Health and Wellbeing area served more than 3,000 children and more than 7,000 caregivers during the fiscal year. Nearly 1/3 primarily spoke a language other than English, and First Five serves a larger portion of Hispanic, Latino, Black, and African American participants compared to county representation. 41% of the participants who completed a family information form at intake reported an income less than $15,000, and nearly all of the participants were earning less than the county median, as well as the family self-sufficiency standard for Sacramento County. Nearly 4 out of 5 reported playing with their children 5 or more times a week or telling stories and singing songs with their children, while about half agreed that they read with their child 5 or more times a week. The majority of the participants did, after receiving services, also said that they knew what program to contact for help with basic needs, and they knew where to get helpful information about parenting. And at follow-up, nearly all of the children had had a well child visit in the past 12 months, and the access to dental visits significantly increased. Starting with our more program-specific strategies, this is the perinatal health subdomain of health and well-being. We have the Black Mothers United Pregnancy Peer Support Program, or BMU. BMU served 93 participants, including 76 receiving prenatal support and 17 who engaged in the postpartum support after delivering in the prior fiscal year. There were 45 infants born, 89% were a healthy weight and full term, and there was only 1 infant who was both preterm and a low birth weight. And importantly, the number that we love to see each year when we present this, there were 0 newborn deaths at program exit for the 6th consecutive year. The participants significantly increased access to cribs, car seats, and WIC enrollment, and they also increased access to housing, transportation, employment, and food. And there were a number of health risk factors significantly associated as predictors of birth outcomes, which further reinforces that importance of the work that BMU does, both in terms of the prenatal support as well as the systems work that they're doing with health systems to ensure that mothers have access to risk-appropriate medical care. Our other perinatal health strategy is the Safe Sleep Baby Training and Education Program to promote infant safe sleep. There were more than 250 providers trained to promote and support safe sleep messaging. Over 900 caregivers completed the Safe Sleep Baby workshop, and more than 500 First Five funded cribs were provided to caregivers in need. The caregivers significantly increased knowledge of safe sleep practices and behaviors, and significantly more caregivers were practicing the ABCs of safe sleep, meaning that their infant always slept alone, on their back, and in a crib. Next is the WIC Community Lactation Assistance Program for breastfeeding support. The First Five funded services reached more than 2,000 caregivers via lactation assessments, helpline services, follow-ups, and home visits for high-need lactating mothers. 96% of the participants completing a follow-up survey said they were extremely satisfied with the lactation support they received, and WIC participants had slightly higher rates of exclusive breastfeeding at 6 months compared to most recent national and statewide estimates, and we're about 14 percentage points away from the Healthy People 2030 goal. For the Health and Wellbeing Child Safety subdomain, we'll start with Birth and Beyond Family Resource Centers. Birth and Beyond's First Five funded services reached nearly 2,700 families with children ages 0 to 5 through home visiting, crisis intervention, and group support. We had over 800 caregivers participating in home visiting using the Parents as Teachers model, which is offered at all 9 FRCs, as well as the effective Black parenting curriculum offered by the 2 RAACD-funded programs. Caregivers showed significant improvements in protective factors, and 12-month outcomes for families served in the prior fiscal year showed lower rates of substantiated maltreatment, especially after at least 8 hours of home visiting. The more than 1,700 caregivers received crisis intervention, resources, referrals, and/or case management based on their individual needs. The participants who worked with a crisis intervention specialist for case management most commonly noted that their needs were related to housing and employment, followed by clothing needs and help with utilities. And at follow-up, 77% showed improved self-sufficiency and stability in at least one of those focal areas. Birth and Beyond's group support and connection reached nearly 1,300 families who participated in activities like car seat workshops, backpack or diaper distributions, support groups, bilingual story times, and more. Follow-up survey participants reported improved protective factors, such as more knowledge to support their child's development and knowing how to access resources in challenging situations. Our child safety subdomain also includes crisis nurseries, emergency daytime and overnight care, and case management. 333 children stayed at the crisis nursery 1 or more times during the fiscal year, and according to data collected at each stay, the most common reasons were employment needs, parental distress, and housing or homelessness. At child pickup, more than 99% of participants agreed that crisis nursery kept their child safe and secure, and that they felt better able to solve their crisis situations because of the support they were receiving. There were also significant reductions in the self-reported stress levels and significant decreases in how much they felt that stress impacted the care of their child. Our last health and well-being subdomain is the child development and education strategies. So we'll start here with Help Me Grow, providing developmental screenings, trainings, referrals and connections, and individualized support, including home visits. There were more than 25 health care providers receiving technical assistance and training on the Ages and Stages Questionnaire Developmental Screener. More than 1,500 caregivers engaged in Help Me Grow outreach and informational trainings, and more than 400 families received home visits from a family advocate. There were close to 600 ASQ and ASQ social emotional screenings completed by Help Me Grow or online with follow-up by Help Me Grow staff. 55% of the ASQ and 39% of the social emotional screenings were flagged for further evaluation and provided resources and connections to additional services. So while this looks like an alarmingly high percentage, we have to recognize that it is largely because Help Me Grow targets high-risk populations, and they're commonly, families are commonly referred to Help Me Grow when there's a potential concern, just reinforcing the importance of the navigation support for families with high needs. 49 children participated in developmental playgroups for children with exceptional needs provided by the UC Davis Mind Institute. 2/3 of caregivers completing a family outcomes survey agreed that this early intervention helped their children develop and learn. And on average, participants agreed that they had access to the community for basic needs and social engagement, and that their family had social support. Our last health and well-being strategies are the family engagement and connection activities across 9 school districts, including the playgroups, parent cafes, as well as 16 trainings to train providers to become parent cafe leaders. More than 800 children attended playgroups with their parent or caregiver, and 167 caregivers attended parent cafes. Nearly all of the parents surveyed agreed that the playgroups gave them new ideas of activities to do with their child, and nearly all of the parent cafe participants surveyed said that they wanted to get more involved in their schools and that they felt safe sharing or that they learned from others' experiences through the parent cafe. For the quality childcare priority area, we'll highlight the support for early learning sites and providers, including the short-term consultations and long-term coaching provided by PBM. 31 providers received an average of 10 short-term consultations for our short-term section. Most had a child-specific behavioral concern reason for reaching out, and 73% of the children in these instances were able to remain in their placement. For long-term, there were 109 providers who participated in the long-term coaching, receiving an average of 24 coaching sessions if they participated for the full year. Among the program completers, 86% showed improved assessment scores, and 45% of the sites with providers participating went on to enroll in Raising Quality Together, which is Sacramento County's Quality Counts California program. Next, the parent partnership domain is focused on giving parents decision-making power and building parent caregiver leadership. We'll take a look at the Parent Leadership Training Institute that I know we've talked about quite a bit throughout our discussion, which is offered annually in English and Spanish. And as Julie mentioned, the 2024 to 2025 cohorts resulted in 75 total graduates since PLTI started in 2023. We surveyed and interviewed alumni from these first 3 years, and most agreed that they had recently participated in civic activities like volunteering or participating in an organization or group seeking to make a difference. And in addition to having recently done that, that they also plan to again. Alumni also described PLTI as engaging, supportive, empowering, valuable for personal and professional development. And for many, the resources like meals, location, and childcare provided during PLTI sessions made it possible for them to participate. Lastly, we have the systems improvement strategies. These activities range from work with health systems to community collaborators, which promote safety and wellness, as well as advocacy and priorities, advocacy for the priorities and investments currently, as well as workforce strategies, and again, as Julie mentioned, the CalAIM funding. First Five Sacramento also worked to strengthen relationships between organizations and promote the Sac Family Connect website. And that concludes my very, very high-level overview of such great, thorough work being done.
Oh, no, we could have 2 hours of all the great work that's being done. And I just say I'm always impressed when I see the numbers of how much is actually getting done at this level. And still, we see the need is still even higher out there. So thank you. Let me bring this to the commission here. Commissioner Wesley?
I just only had one question around the crisis nursery that divided up the need for that support. And my attention was drawn to the 56% around for employment. Is it because they needed childcare or?
Yeah, so most of the time, because since we did a special study on crisis nursery last year, so I'll just speak to the participants and the stories that they shared during that time. Most of the time, it'll be their regular childcare fell through at the last minute. A lot of them mentioned things like, "I'm going to lose my job," and I like, what do you do in that instance if there's oftentimes unsafe alternatives for their child. We saw some people shared information about that during their interviews as well. So yes, more than half are because they either have regular childcare that had some sort of issue for that emergency moment at the last minute, or that they're struggling with safe and stable childcare.
Boy, that is a topic that we had this morning at SETA, and it's an important one that if we're, I think with the threats at the federal level, a number of us went out to cap and advocated, and I do want to thank Supervisor Desmond, who he and I went and met with a Republican congressional member in Appropriations Committee and talked about how essential child care in SETA and any aspect of it keeps people in the workforce. But if you don't have a safe place for your kids, then that's the first thing you're going to do is keep them safe before you leave the workforce.
Yeah, I'm thinking that's something I work on this on the federal level too. I'm everywhere, and I think that's something we can keep bringing up. I know Republican Kylie might be one we engage when some of us are doing any of those policy visits.
Top of mind, yes. Okay, Commissioner Fernandez y Garcia.
Yeah, and I'll just add to that, it was 333 children, I think.
Yeah, that was the unduplicated number in the fiscal year who had a stay. So that's our total number. And the participants can select multiple reasons for their stay. So those aren't mutually exclusive percentages either. But the unduplicated number is the 333, but those percentages are based on each stay. So they often come back throughout the fiscal year. That's a common highlight that we see for crisis nursery as well, is that families feel safe coming back.
And that's great. You know, I recommend crisis nurseries every week.
I live in
to
Florida,
families.
and I am telling people about it. So
No, but I
you
mean
wanna know this crazy
families
program?
here in Sacramento. And so the fact to get somebody to have trust in trust enough to drop off their most precious thing and trust that you'll take care of them. You got 333 kids, you know, but the need is probably 5 times that.
Yeah,
And so I just, you know, I think the crisis nurseries are amazing. If you could somehow capture how often people aren't, you know, are thinking about it, there's some reasons why they don't. I mean, that would speak to the need. I think more than the people who actually utilize it.
Yeah, and they do a lot of work juggling. I mean, everything is done so, you know, last minute on the fly. They do what they can to fit everybody in however they can. It was really inspiring and informational when we did the special study with them. So.
Well, thank you. And again, on the crisis nursery piece, the financing and the mechanics of actually running a child care center are so rigid and difficult that predictability doesn't allow for them to be successful. Like, you know, even now, unfortunately, with the way the state approached, and probably controversial to say, but I have no problem saying it, the approach that the state went on, you know, universal TK has basically punched a hole in the ability for us to support many of the child care centers. And that has left an even bigger hole, because now when we're losing those places that maybe could have done a 2-day or 3-day slot for someone, now they can't do that. And so I think the child care nursery is just essential to have that. And most folks aren't aware that that's actually something that we have to offer when I talk about it as well. So. But yeah, thank you again for that point there. Yeah. Whatever it is, whether it's a medical appointment or work-wise, I mean, those are key things. So
I'll make sure we share with you the PDF of the special study that we did with them last year. There's just amazing quotes and explanations from the participants.
Thank you.
I just wanted to share, I'm Carmen Garcia Gomez, Evaluation Manager. I just wanted to share with you the revamp of our report this year. I'm sure you have noticing that it's like 60 pages shorter than it typically is. We separated the report in 2 parts. So this is the impact report, and we have a data book that lives on our website. So if you wanted to look at the data, the RBAs, other charts and tables, it's there, or you can email us and we can get it to you. But I'm so excited with the look of this. It's easier to read. It's more appealing to not just, you know, commissioners and staff, but also hopefully to parents and to other community members to share all the wonderful work that we're doing.
Great. Thank you, Carmen. Well, I appreciate that. Seeing no other commissioners, Madam Clerk, do we have anyone signed up to speak on this item?
No, sir, we do not.
Okay, thank you very much. Thank you all for your time today. You know, appreciate everyone's robust discussion here. And if there are no other comments, Madam Clerk, let's move on to our last item.
That would be the commission member comment.
Any comments from our commissioners today? Seeing none, then we will adjourn today at 3:10 p.m. Thank you, everyone, for your time.